Dr. Jeff talks love. Dr. Jeff talks life. Answers your questions, cuts through the strife. Sex and intimacy, real and true. Evidence-based, made just for you.
Hello and welcome. Welcome to Dr. Jeff Talks about sex and intimacy, where we bring compassion, science, and real conversations to the heart of sexual wellness. I'm your host, Dr. Jeff Albaugh. Today, you're joining us for episode 49, Reclaiming Pleasure After Trauma, a journey of healing with Dr. Holly Richmond. Now, whether you're watching live or whether you're listening to the recording later, I sincerely want to take a moment to just tell you thank you. Thank you so much for being here. I truly appreciate every single one of you out there. Your engagement, your curiosity, and your willingness to learn is exactly why this podcast exists. So thank you for being here. I so appreciate you. Well, we're connected across so many platforms. We are on Facebook. We are on YouTube. We are on LinkedIn. If you're joining us on X and you want to submit a question, you can hop over to YouTube and you can, or LinkedIn or Facebook or StreamYard, any of those places to submit those questions directly. A quick favor, if you are a Facebook person, please follow us. The more people who follow us on Facebook, the more we get to do on Facebook. So we really appreciate our followers on Facebook. But we're so glad you're here, however you're here. Visit the website. If you've never gone to the website, there are 48 previous episodes and now 49 after we finish tonight. And all these amazing experts that have shared their expertise. You can learn all kinds of things about sex, intimacy, and relationships. So go to the website and watch the previous episodes. Also, you can pull up the calendar and see what's coming up all the way through March. All the great people who are going to be joining me in future episodes. So go to the website and find out what's going on. Also, you can take Dr. Jeff wherever you go. We're there with you. If you're exercising, if you're in the car, listen to us in your car. Listen to us while you're exercising on your favorite streaming services such as Spotify, Amazon Music, iHeartRadio, wherever you're working out, whatever road trips you're on. Dr. Jeff Talks About Sex and Intimacy is there with you on those trips and happy to provide this evidence-based information. So I'd like to remind everyone, as I do at the beginning of each show, that everyone is welcome. You, listener, you are so welcome at this podcast. Whatever your sexual orientation, your gender identity, or your relationship style, you are welcome in this space to learn. We're so glad that you're here. The mission of the podcast is pretty simple if you're new to it. It's to empower and enlighten you with the evidence-based, that's the scientific-based information that you need to improve your sexual health and deepen your loving relationships so you can live this one miraculous, fabulous, wholehearted life of yours more fully and more lovingly. Today, what are we doing? Today, we are exploring what it truly means to rediscover safety, sensuality, and pleasure after experiences that may have shaken your sense of trust, both in your body, you experience in your body, and in your relationships. We're talking about reclaiming pleasure after trauma, an experience so many people silently navigate, often without the tools they need, the support they need, or even finding the language to understand what's happening in their bodies and their relationships. Healing from trauma isn't linear. It's not a one-size-fits-all kind of deal. But with the right guidance, people absolutely can reconnect with their bodies. They can rebuild trust and rediscover pleasure. And there's no better one to help us explore this path that I can think of than my guest today, Dr. Holly Richmond. Dr. Holly Richmond is one of the nation's leading certified sex therapists and licensed marriage family therapists specializing in sexual health, somatic healing, and the integration of trauma recovery with pleasure-focused therapy. With a unique blend of neuroscience, somatic psychology, and sex therapy, she helps individuals and couples move from a place of disconnection and surviving, into embodiment, joy, intimacy, and thriving. Dr. Richmond is the author of the acclaimed book, which I use with my patients, Reclaiming Pleasure, a sex-positive guide for moving past sexual trauma and living a passionate life. This is one of two main books I use with my patients in my clinics. And the other book is Healing Sex by Stacey Haynes. But Dr. Richmond is a respected educator. She is a speaker. She is a consultant who regularly contributes to national media outlets and serves as a clinical thought leader in the field of trauma-informed sexual wellness. Through her clinical practice and public education work, Dr. Richmond is dedicated to empowering survivors. Remember, that's what this podcast is about, empowering you with practical tools. Sounds good. With compassionate insights and the reassurance that pleasure and wholeness are not just possible, they are deeply deserved. You are deserving and worthy of pleasure. So without further ado, I am so excited to welcome our guest tonight, Dr. Holly Richmond. Thank you for joining me.
Hi, Dr. Jeff. I am so happy to be here. Thank you again for the wonderful invitation and introduction.
Well, without further ado, because I can't wait to hear what you have to say. And I know I attended your 4-hour course and you have so much to share, but I'm excited to hear what you have to say and I'm going to hand it over to you. It's all you.
Perfect. Thank you so much. So as always, for the format of this podcast, we're going to try to do this in about 15 or 20 minutes. And I'm so excited to hear your questions afterwards because we're going to go big picture and then we'll bring those questions down to really the how-to. So Jeff already introduced the course and my book. So I wanted to start with my research question, like how did this come to me? Like what was the reason we're studying sexual trauma and pleasure? It was really this piece of the difference between surviving versus having pleasure and thriving. So I did most of my 3,000 hours for my licensure at a rape crisis center. And I was taught very well how to treat sexual trauma. But what I noticed is no one was talking about the what comes next. And the what comes next to me was really how do survivors reclaim really solid relationships? And more so, how do they reclaim great sex? So the pieces that we put together are trauma. And then I have a PhD in somatic psychology. So we got trauma, the body, and then sex therapy. And all of those go together for me. So you're really getting a crash course in those three elements and how survivors reclaim the pleasure that they deserve. So we're going to start out with a roadmap of where we're going. What thriving really means is a pointing towards eros or eroticism. Now, eroticism can be sexually driven, but it's not necessarily. This word, this root Latin word, eros, really means life force, vitality, vivacity, creativity, imagination, fantasy, and co-creation. So for survivors of sexual trauma, we don't just want to get them to the place where they're like, I'm healed and that's good enough. We really want them to this place of living a completely self-efficacious, fulfilled life. So this element of eros. At the beginning of my book, it's very heavy on definitions. We're not going to go through all of that tonight, but I did want to give the broad framework of sexual trauma. So sexual trauma is a term used clinically, generally not legally or empirically, because it allows for a wider gradation of scope and ambiguity in labeling the experience. It also offers survivors and clinicians terminology for collectively understanding without stigmatizing, which can happen when details and descriptions are provided in a more exacting way. Using the term sexual trauma is an appropriate and accurate way to describe any unwanted sexual experience in a clinical or social setting. So the terms that are important, just for example, would be, what's the difference between sexual assault and sexual abuse? What is the true definition of rape? What is the definition of sexual harassment? So when I'm working with people, it's important to me that I help them identify what happened to them. Once they know, they don't have to use those words. Let's say that they were raped. They don't have to ever use, even with themselves or their clinician or anyone that they would share with, that word. They could say, I am a survivor of sexual trauma, and that's perfectly fine. So everything we're talking about tonight will fall under this umbrella. So the broad effects of sexual trauma are an increase in the prevalence of psychological and physiological symptoms, including depression and anxiety disorders, post-traumatic stress disorder, rape-related post-traumatic stress disorder, chronic pain, autoimmune disorders, rumination or OCD, low self-esteem, lack of personal boundaries, difficulty identifying feelings, so alexithymia, dissociation, and again, OCD. Let's just jump right in with misconceptions about sexual trauma. So what the media wants us to believe is that sexual trauma is perpetrated by the person that jumps out of the bushes or is hiding in the backseat of the car. Most sexual trauma, over 85%, is perpetrated by a person known to the survivor. And most of the time, it is not reported. The majority of the time, it is not reported because the survivor knows the person, and it's a very confusing process, especially at the beginning, where they're trying to figure out what happened to me. So this first misconception is that it takes on average about 10 years for a survivor of sexual trauma to seek treatment. Why is that? Because they minimize what happened to them. They don't want it to be a big deal, and they just go on with life. But symptoms start popping up, whether that's alcohol use disorder, drugs, inability to maintain a professional career, inability to maintain healthy relationships, eating disorders. So all of these things are popping up. And most of the time, the survivor doesn't want to connect their sexual trauma to what's happening in their life now until that kind of penny drops and they're like, oh, maybe what happened to me all of those years ago is really impacting me in these areas. So it's not that it happens and someone walks into a crisis center or therapy a few days later. Sometimes, obviously, that can happen, but not most of the time. Sexual trauma can happen to a single person more than once. And I remember when I first started at the Rape Crisis Center, and one of my clients had, I think, 5 or 6 experiences of sexual trauma, everything from sexual abuse to several sexual assaults and sexual harassment. As a new clinician, I was like, oh my gosh, how could someone be that unlucky? It's not unlucky at all. It's very common. And the reason why it's common is 2 factors, mostly shame and low self-worth, which includes poor boundaries, a lot of people pleasing. So those are the constructs that really set someone up to experience this multiple times. The reason why anyone experiences sexual trauma is entirely unfounded. So I have a quote that says, I don't care if you were sitting on a street corner naked. The only reason you would be raped is because a rapist walked by. It doesn't matter that you had no clothes on. It doesn't matter that you had a short skirt on. It doesn't matter that a guy was in a gay club. It doesn't matter if you were drinking or if you had been using other substances. There is no reason why anyone has sexual trauma perpetrated against them other than the perpetrator. The next misconception is that survivors frequently false report. I feel like since Me Too, which did so much good in this area, there's been a little bit of a backlash of, a lot of false reporting out there. That is just categorically untrue. Survivors do not frequently false report. False reports come in at exactly the same rate as other felonies, which is only 2 to 8%. The reporting process for sexual trauma is still awful. It takes years and years and years. The survivor really has to prove themselves. It also often comes down to they said. So this is not a process that someone willingly steps into. What I was talking about before with the misconception about how sexual trauma is perpetrated, again, most sexual trauma is not violent, it's violating. This is perhaps the biggest mind shift that will really help drop people into what sexual trauma is, because it's most often, again, not perpetrated by a stranger, it's someone jumping out of the bushes. The last piece is the treatment of stranger rape versus the treatment of most sexual trauma is quite different. And this really dropped for me several years after I had been at the Rape Crisis Center, because I was treating both. One is not better than the other. They're both horrible. But when we're working with a stranger rape, so this violent offense, typically that survivor is going to come in for help right away, because they are going to report. They're going to come in for help because in their head, they're like, that happened to me. I did not do anything to cause that. That happened to me. Whereas most sexual trauma survivors, they are perpetrated against by someone they know. So they might have gone on a date with this person. They might be living in the same house with that person. So there's this implicit sense of, in some way, that was my fault. I must be complicit with that. And then the shame drops in and they don't say anything. So most of the working with trauma survivors starts with kind of dismantling that shame piece. The piece that I've been so interested in my whole career is moving from sexual trauma into sexual health. So what is sexual health? It's a state of physical, emotional, mental, and social well-being related to sexuality. It is not merely the absence of disease, dysfunction, or infirmity. Sexual health requires a positive and respectful approach to sexuality and sexual relationships, as well as the possibility of having pleasurable and safe sexual experiences, free of coercion, discrimination, and violence. For sexual health to be attained and maintained, the sexual rights of all persons must be respected, protected, and fulfilled. So I know that's a lot to take in, but essentially sexuality is a necessary and deserved part of our whole health, our mental health, our physical health. So sex and self are not dualistic. There's not me over here and my sexuality over here. It is one and the same. And we know that when we disconnect from our sexuality, we truly disconnect from ourselves, and we disconnect from that quality of eroticism. So drop right in. What is sex positivity? What does that mean? I know we all have a sense of it, but my definition is very simple, and it's this: all sex is good sex as long as it's consensual and pleasurable. So consent has to be first and foremost. And then as we start talking about the sex therapy piece of this, the sex positive, pleasurable pieces of it, it really comes without judgment. So there's nothing weird. There's nothing, we don't use those judgy words anymore. If we check those two boxes, is this consensual and is it pleasurable? And I've worked with so many sexual trauma survivors that have some kinks or fetishes, some that I hadn't even heard of before. And I just do the math, because there's nothing weird or abnormal. Is it consensual and is it pleasurable? If so, it's all good. And we move people towards the direction of their own personal fulfillment. The body is critical in the recovery of sexual health after sexual trauma. So somatic, body-based. Safety nor pleasure can be reclaimed only through the mind. These are sensational experiences which are physically sensed and emotionally felt. In the moments the body feels unpredictable or unruly, it is not trying to betray us, but rather to save us. So for a lot of survivors of sexual trauma, they have symptoms that manifest somatically, and we're going to talk more about that. Our bodies become stuck in survival mode after a sexual trauma, even when a trauma occurred so long ago that the brain has long since buried its memory. The body remembers. So for so many of my clients that walk through the door, they come in because of physiological symptoms, right? They're high functioning. They've just kind of like buried the trauma in the back of their head, but eventually their body starts yelling or saying, notice me, notice me, notice me in some way, because things aren't right. They haven't integrated that yet. So if we have this body who's manifesting symptoms, how do we work with that? So I use something called the pro-symptom approach. Asking what is wrong with me is the wrong question, right? So if someone walks in the door, says, this is wrong, this is wrong, this is wrong. Why can't my body do everything else someone else's does? Why am I feeling this way and they're not? Instead, we need to ask, what is your body saying that you cannot? So we're listening to the meaning as well as the pain. So again, whether the symptoms is headache or something with digestive issues or pelvic floor functioning issues, erectile functioning issues, we're listening to the meaning and we're seeing where's the brain-body connection and how can we really get to the bottom of that and help integrate it. And the somatic approach is really doing that from the bottom up. So typical therapy is going to be talk therapy, and it's a very cognitive process. What I do and what a lot of sex therapists do, how do we include the body in this so we're listening to all of these channels for really rich information? Speaking 2 slides ago, we said that trauma, when someone is still in a traumatic response, they are in the past because they're in my office. I'm looking at them. I can see that they're safe now. So really the role of trauma therapy is to relegate the trauma to its respective place, which is in the past. So separating the past from the present. And my favorite mantra for doing that is this: that was then, this is now. That was then, this is now. And then to do some kind of grounding exercise to really come into the body. And I know Dr. Jeff does a lot of grounding. We're going to do something after this presentation to get us back in our body. And I have a few examples here. So the somatic healing aspect, survivors of sexual trauma have extraordinarily sensitive nervous systems, wired particularly to the nuances of relationships and the inherent expectations that live within them. So how we extrapolate that is when you heal your trauma, you heal your nervous system. When you heal your nervous system, you heal your body. And when you heal your body, you heal your mind. So you can feel that bottom up and that we're centering the body and the nervous system in order to help it integrate and solidify for our cognitive healing. So it's kind of the opposite of CBT, cognitive behavioral therapy. So it's very body-based. So let's look at some of the common wounds that we see from sexual trauma. We're going to go through these pretty quickly. So emotional effects, difficulty regulating emotions or expressing them, feeling out of control, rumination, feeling confused, inability to focus. So lots of emotional effects. There's also physical, of course, physiological consequences, eating disorders at the top of the list, poor body image, nightmares, sleep paralysis, vertigo, sexual compulsivity, low desire, high desire, avoiding sex, using sex for power, control, anorgasmia, which means inability to have orgasms. And then finally, this fourth sector is the relational effects. So people that struggle most in this area really struggle to maintain healthy relationships. So again, those 4 quadrants: emotional, physical, sexual, and relational. We have to look at all of these in order to move towards that holistic goal of healing. So my dissertation was grounded theory and really looked at what are the components of the recovery of sexual health after sexual trauma. And I came up with 3. The first parameter is control. There's 2 subsets in here. So the first part of that is maintaining control. And the second part is relinquishing control. So it probably sounds self-evident. Of course, anyone who's experienced sexual trauma is going to really want to maintain control. Where are they, who they're with, where their body is in time and place, and if they have control of it. Yes. The flip side of this is, how do we help those people relinquish control? How do we move towards flexibility instead of rigidity? And that is a lot about creating safety within themselves and within their bodies so they can be vulnerable. I'll work with the nervous system here to really promote this feeling of control. How can I maintain, yet how can I let go? The second component that I discovered is pleasure. And this is really the exciting one. And this is the piece that has been left out of most sexual trauma healing. So when we're looking at pleasure, we know that to reclaim the essential facets of sexual health, it's time to affirm pleasure as a birthright, not an afterthought. As survivors learn to prioritize pleasure, sex will transcend an act of physicality and become an undertaking of self-forgiveness, self-acceptance, and self-empowerment. I help my patients discover their sexual template, which is made up of two components. The first is desire, and the second is arousal. So desire is a psychological process of wanting, and it asks, what do I find sexy? So this is really cognitively based. What am I attracted to? Where arousal is a physiological process, or the physiological process of wanting, and asks, what turns me on? So when we can really get in there and dissect this, and most people have never done this, they've never considered, what do I want? What turns me on for me? Not what my partner wants, not what society tells me I'm supposed to want, but what is my sexual template, which is essentially what is my sexual blueprint or my sexual fingerprint that's just uniquely mine. The third component is connection. So we've got control, pleasure, and connection. Connection, these are just three quotes that I love. So healing doesn't come from a lack of threat. It comes from connection. You cannot save people. You can only love them. And to me, this is like a down-regulating the nervous system so we can feel grounded and embodied. And the third is serenity, or healing is not finding calmer seas. It's building a better boat. And that better boat is connecting to our body and connecting to our mind, connecting to our wants and our needs. The principles of connection show us that most people are only as needy as their unmet needs. Not only does connection play a central role in breaking patterns in the symptoms survivors experience, but their physical and psychological stress will improve as well as we really help them connect to others. Connection's primacy and the ability to heal and thrive is absolute. So this is not me saying that every survivor of sexual trauma, in order to be holistically healed or get to that space of thriving, has to be in a romantic relationship. That's not what I'm saying at all. What I'm saying is that they can't be isolated and doing this on their own. They have to have people, purpose, causes in their life where they feel that sense of connection. It can be an animal shelter. It can be a volunteer. It can be through work. It can be their family. But there has to be other human beings involved where they can express their authenticity and learn to be vulnerable. I also look at fantasy because that's a very left out of part of sexual trauma therapy. So we also want to talk about how sexual trauma, a lot of people think that it informed their fantasy, their kinks or fetishes. That is not true. Sexual trauma doesn't inform or orient. It misinforms and disorients us. So we learn to work with a fantasy, we learn to work with those proclivities and figure out if those are really about us or that if that's left over from our sexual trauma. And then finally, liberation may not feel like joy. Recovery and reclaiming pleasure is about untethering from the past, unwinding hyperarousal or that real sense of anxiety, disengaging from unhealthy relationships, discovering eros, and just this last note that freedom and grief are not mutually exclusive. So in this healing process, as Dr. Jeff said, it's not linear, and bumping up against these places of grief, even though you're in the healing process, can absolutely still happen. So these are three things that I would love every survivor to be able to do, is to retell your story without shame. Dare to empathize first with yourself and what you went through, and then with other survivors who don't feel like their sexual trauma counts. And then the third thing, the big kind of F you to the system and perpetrators, is to have great sex. Like, learn how to be in your body, embodied, and reclaim what is yours. Here's a slide on sexual trauma prevention resources. So I know you all will have access to this. And I teach at Modern Sex Therapy Institute. So I just wanted to mention that here too. If you're looking for more classes on all types of sexuality, you can find them there. And here is my book, Reclaiming Pleasure, which you can find all the places where books are sold. And we've got questions and how to find me. So drhollyrichmond.com or on social media. Thank you guys so much.
Awesome. Such good stuff. Gosh, there's so many good things to unpack and think about. Awesome presentation. I just loved it. And you kind of went through, like in the beginning, what we do with our patients too, and what patients experience, how we start by trying to help them understand the impact of the trauma on them. And what they did, which worked, was dissociate, and it worked beautifully in the circumstance, but now they're dissociating from their life and their pleasure and their relationship, right? So that's kind of the first step, is that. And then also coupling that with moving beyond shame, letting them know, just as you said, you could not have done, you need to stop questioning yourself. You couldn't have possibly done anything to allow this event to occur. Nothing you did. Stop questioning yourself and the choices that you make, and know that something happened to you. You did nothing wrong. And you got to think, my gosh, this is probably the tip of the iceberg, but 1 in 5 women, 1 in 3 men have experienced some sort of sexual trauma. You're not alone. You did nothing wrong. So removing the shame, knowing that you stop trying to pick apart everything you did and where you might have opened yourself up to this. There's nothing you could do to open yourself up. I love your example, the naked person on the street. That person did not open themselves up for sexual assault, rape, or anything. I think it's really powerful.
Yeah. And I think I didn't say the last part of that quote. Oh my gosh, I was going so fast. So there's a naked person sitting on a street corner, right? Dr. Jeff, most people would bring them a coat, not rape them, yes. Right? So that's when you kind of take that in. You're like, wait a minute, I was in a vulnerable position and this happened to me. Like, that can rewrite that story of someone should have been looking out for me, right? Not taking advantage of me.
So what happened to you, you know, the circumstance that happened, you were there naked for some reason, and who knows what that was. The right choice for the people around you to do would be to help you, to offer you that coat, to say, oh my gosh, can I take you inside? Or, you know, what do you need? What can I do to help you? Certainly not to take advantage of you or do sexual assault or anything. So I think helping them understand what happened, the impact of that in their life, and how it is showing up in their body, and then removing all that shame is so important. And then I think cultivating that safety. I know your patients, like my patients, and I'm sure a lot of the listeners out there, they're hypervigilant, they're scared, they're freaking out. So I try to have them, again, come back into their body and think about, right here in this space where I am, is it really safe? Am I safe right here? Yes. And realizing that these triggers are coming up for them, but challenging those triggers, knowing that they are safe in this moment. But especially when something happens sexually, and it may be something wonderful like a loving touch on the back of small of your back, which could be considered so loving, but it's similar to the touch that you felt during the assault. And so it triggers you.
Yeah. And Jeff, the slide that I didn't have up that I want to talk about, because you brought up dissociation, I was assuming probably most of your listeners know at least the 3 trauma responses, but I hope people now know the 4. So we've got fight, flight, freeze, and fawn. Most sexual trauma survivors are going to either freeze, so that's the dissociation that Dr. Jeff was talking about, and even more than that, are going to fawn. So fawn is going along to get along. Fawn is being nice to get yourself out of that situation. It's a really adaptive response in the moment, but it confuses the heck out of survivors because they're like, that person did that to me, but then I was kind of nice to them and they sent me a text after they date raped me and I replied back. That is fawn. That is a mechanism to keep yourself safe because you've got no chance to fight back. Usually a perpetrator is bigger. You're not going to run away. And if dissociation wasn't an answer in that moment, you're like, how can I get myself out of here? Oh, I'm going to pretend nothing's wrong and be really nice. And it usually works. So, but people feel so bad because they're like, I didn't scream, I didn't fight back, I didn't say no. Well, I guess it's my fault then.
That is how you got out. That is how you survived. That was a survival technique and absolutely imperative. And when you look at a lot of like the different things on serial killers and stuff, the people who got out and survived were the people who fawned. It was, you made those choices to survive a very difficult situation, listeners. And so know that you did nothing wrong. You did nothing wrong, and no one deserves what happened. No one deserves it. And I try to, as soon as first off, and like you, I know we approach things very similar. I tell people, you can tell me as much or little as you want about what happened because I'm going to be able to help you whether you don't tell me anything about what happened or not. I'm still going to work with you and help you. But once they tell me whatever they tell me, the first thing I try to say to them is, I am so incredibly sorry that that happened to you. No one deserves that, and you did absolutely nothing wrong. I think that's really powerful, but can they tell that to themselves? That's where we're really trying to get with them, right?
That's the work, and that takes months or years or however long it takes. And yeah, Dr. Jeff, you saw my presentation. One of my most profoundly healing journeys with a client, I barely knew any of the details of what happened to her, and I don't need to know. And if you're going to find a therapist to work with you, you do not have to tell them the details of your story. They're going to need broad strokes of sexual abuse, sexual assault, kind of that framework, age range. You do not need to ever share those details. But there's also other people who are like, I need to share these details. Can I please share this with you? Absolutely, you can do that too, but it's not a prerequisite for healing or therapy.
Right. And so that's what's so amazing about each of us human beings. We're all different. We're all unique. We're all miraculous. And sometimes part of your healing process is telling your story to people who have earned the right to be a part of your story, like your therapist and other people in your lives that you feel comfortable doing that with. People will tell me, I have one of my patients who said, I haven't told my husband. I'm not sure I'll ever tell him. And I say, only you get to decide about that. And whether you tell them or not is completely up to you. And you can still have a deep, meaningful relationship, whether you tell them that really traumatic story or not.
Yeah, because I think people are afraid, what will that person think of me? How is this going to change things? I don't want to be pitied. I don't want someone to, or even the other side, I don't want someone to think I did something wrong. Like that shame pops back up real quick when a relationship feels threatened, right? Can I tell my husband, even though I know he's such a safe person, but what if he thinks different of me?
Right. And that's hard for all of us. What we don't realize is so much of what happens is about us, not about our partner. So it's not necessarily about, will he react poorly, but it's about, I don't want to become a different person in this relationship because now they know this about me, right? It's like it changes me. It could change the dynamics. So it's not necessary and part of the healing, but understanding what happened and how it shows up in your body and the different effects that it's having on you, what it means to dissociate, to be triggered, when you're triggered and dissociating, because now you want to be here. You are living this one beautiful, miraculous life and you want to be present in it. So how do we pull you into this moment, this now? And that's the work we do with our patients. And so that's when you talk about, and listeners, if you don't know, somatic means body centered. And so we do all this. somatic work. And the work I do with my patients, your book, Stacey Haynes' book on healing sex, as well as The Body Keeps the Score, they're all about somatic work. They're about what's going on in your body. You're reliving and re-triggering and becoming hypervigilant. I need you to know when that's happening so you can be aware of it and you can make choices and control what your body's doing. And that's the work that we do, is helping people understand, okay, I'm triggered. Wow, what can I do about this? And I love too, you talk about this as well. And so what we do is, what do I need right now in this moment when I'm triggered? Do I need to self-soothe and down-regulate? Or do I need to get moving and get into my body and get out of my mind, which won't shut up, and up-regulate?
Yeah. Yeah. And so Jeff, just real quick, I just use a scale 1 to 10. 1 is kind of collapse, laxity, depression. 10 is full on panic attack. So we've got hypo arousal at 1, hyper arousal at 10. Our sweet spot is 4 to 6, and that is the range of flexibility. So that's what we're always aiming for. There is no life that is always going to live in that zone. But what Dr. Jeff is saying, when you know you're at an 8, you're going to have some tools to regulate yourself back down to a 7 and then maybe 6. Or if you wake up just feeling quite depressed, collapsed, you're at a 2, then you'll have some upregulating skills to get you back to a 4, 5, 6.
Yeah, exactly. And so it's learning what are the triggers, kind of trying to get ahead of them a little bit sometimes. And then if you're behind them, what can I do? Do I need to upregulate or downregulate? And I know in my office, patients are just amazed. I just had another patient this week. I talked about it. I talk about this a lot, but I have them connected to the blood pressure cuff, and I have the pulse oximeter and stuff. And I'm like, their blood pressure is really high. They're kind of anxious because we've been talking about a lot of things. And I say, okay, now, we're going to work on some self-soothing. Breathing's powerful. We're going to get you centered back in your body. I just had a guy, and literally, oh, God bless you. He went from 163, his blood pressure was on the top, down to 131. He dropped 30-something points in his blood pressure just through down-regulating and breathing and self-soothing. This is powerful stuff. It can be life-changing for you. So what we're trying to do is get you back in your body so that you can reclaim things like pleasure and joy. And 2, I think what's really important, we have to start, I tell my patients, maybe we have to start with baby steps. Like, can we get you to a place where you can experience just any pleasure, like a pleasureful food, and allow yourself that pleasure? Or can you get used to physical touch, non-sexual touch, from someone, your partner or something, where they just hold you, or a massage therapist or something? Can you just get you into your body and take these little bit easier steps towards, maybe we won't start with sex, maybe we'll just start with touch, or we'll start with embodiment, but all those ways of getting you back into your body so you can feel and experience love, belonging, pleasure. It doesn't have to be sexual, but can you even allow yourself pleasure? I find often my trauma patients, they don't think they're deserving or worthy of pleasure.
Right. Yeah. And Jeff, that's such a good point. I never actually start with sex, right? Like, if we're working with it, and I'm really looking, where do you allow yourself pleasure in your life? And if not, so the word there is anhedonic, right? So just a complete aversion to pleasure. And that gets complicated. I'll just throw that in here. So a lot of times, especially in sexual abuse, so it's a minor, they were sexually abused. Sexual abuse is almost never violent. It's extremely violating, but it starts off as extra care or pretending to be affectionate. So this survivor knew it was wrong somewhere, but their body responded in a way by either getting an erection or having an orgasm or lubricating. And there is a whole nother level of shame. So you can see in that moment how I got to pleasure is dangerous. So I'm going to shut down all pleasure across all aspects of my life. And that's just a big no. So that's what, Jeff, you're talking about. Like, how do we find our way back in there?
Oh, we could talk forever. There's so much to say. And we both, I love my patients and I just want to help them, and I know you feel the same way. And trauma is can be so debilitating. And I say, I don't want you to just survive. I want you to thrive. I want you to have all you deserve, and you deserve so much more than just surviving. So let me I have some good questions that have come up. And the first one is, I'm in a loving relationship, but sex still feels scary sometimes. How can I help my partner understand what I need without feeling like I'm burdening them?
Mm-hmm. So I would answer this question with some version of a protocol that's called Sensate Focus, developed by Masters and Johnson back in the 60s. And it's really a practice of giving and receiving. And it's not sexually based at all. So this is starting out essentially with a version of massage, but there's no genital touch. So for this question, that person, their partner, would give them a sensual massage, just very loving and slow, and ask what kind of touch they like. Do they like firmer? Do they like taps and tickles? Do they like their arms touched? Do they like their back touched? Or does that dysregulate them? And then we progress week by week, and we would add in breasts or butt, and then add in genitals. And you just work your way up to their peak sexual experience. But the whole point of this is they're communicating the whole way. And this protocol only really requires about 15 minutes a week. Or if you're doing it once a week, 15 minutes. Ideally, you would do it 2 times a week. So you're looking at 30 minutes a week just to get everybody communicating about what good sex is and good touch is to that person.
Yes, so awesome. And we've talked a little bit about Sensate Focus in the past, listeners, and it was developed by Masters and Johnson way back when, but it's so amazing and so cool. And it has different levels. And so what Dr. Richmond's talking about, the first level is no breath, no chest, no genitals. So everything else, but no chest play on male or female, if you identify as male or female, or no genitals, no intercourse, but just touch. And really finding out what feels good and then moving through those different levels or phases. It can be very powerful. And I agree. It's a great way to approach. Sometimes even when people are just like, I don't know where to start, that's where we start. Sensate Focus, level 1. One thing I would say always to my patients, and I don't know about you, I say don't overestimate what you can do, underestimate. Because if you say you'll do it once a week and you don't, you're going to be really upset and disappointed with each other. So you tell me what's the very least you think you can manage. And if you do more, hallelujah, even
Right.
better. So
Yeah.
underestimate what you'll do and commit, underestimate it so that no one's hurt with you're not doing that. How could you not do 15 minutes once a week? Sometimes patients are like, I will commit to once every other week. That's fine. Whatever you commit to.
Right. Oh, Jeff, I get even more obnoxious than that. I'm like, when? Like I pin them down before they leave the office. Is it going to be Tuesday? Is it going to be Wednesday? Or if I'm not quite that bad, they'll be like, it's going to be either Saturday or Sunday. Like I really, because people are like, yeah, I've got 30 minutes a week. And then they come back in, they haven't done it. And this happens time and time again. So I really like, let's think about when is this going to happen?
Yes. And like, don't procrastinate it. Don't think, well, I know I have Wednesday and Thursday are good. If you have a few minutes today, do it now because life happens tomorrow. So I'm the same way. And people are like, well, I don't want to schedule. No, put it in your phone, do whatever you have to do, schedule it.
Yeah. Because don't have that, oh shit, we have Dr. Holly tomorrow. Like I'm weaponized. It's like, let's get this done.
Okay, another question came up. My body sometimes reacts during intimacy in ways I don't expect, like freezing or shutting down. How can I explain this to my partner, and what's the best way to navigate those moments together?
Yeah. So the first thing that came to mind here, I really hope they understand what's happening for themselves. And I would say this for them personally needs a little bit more processing. So I would want them to do some therapy around their sexual trauma and their freeze response. It sounds like they froze, and really learning to come back into their body with some of these things that we were talking about earlier with the upregulating or the downregulating. Once they have a really good sense of that, then they could talk to their partner and say, Sometimes when we're being intimate, you might notice that I'm not really here. If I'm not able to make eye contact with you, or if I'm looking away, or if my body feels tense, I am probably in a moment of dissociation. And I would like you to be able to recognize that. I'm going to do my best to be able to tell you that we need to slow down, or I just need you to hug me. But sometimes I'm not going to be able to use those words. So these would be the somatic cues to look for.
Excellent. Excellent. Really good. Oh gosh, we could talk all night, but so there's so many good things, and you got to come back, and we'll have to talk more because it's just so many things to unpack and discuss. But I know listeners have learned so much. So we're going to do a couple things. I'm going to go to a centering exercise and tell people it's coming up next week. But gosh, so much great information, so much great information for you. Before we close though today, I'd like to guide you through a brief centering exercise. Something you can return to anytime or anywhere when you need grounding, reassurance, and as you move along with your own healing path. Okay, so get in a comfortable position wherever you are. Allow your body to settle. If it feels comfortable, soften your gaze or close your eyes, whatever's most comfortable to you. Breathing's powerful. Take a slow, steady breath in your nose and gently exhale through your mouth. About 4 or 5 counts for each. Continue in your nose. Gently exhale through your mouth. As you continue that breathing pattern, as you exhale, let your shoulders drop. Let your jaw loosen. Let your belly soften. You can bring one hand to your heart and one hand to your lower belly if it feels comfortable. As you breathe in your nose and you exhale through your mouth, feel the rise and the fall beneath your palms, your body reminding you that you are here in this moment. You are alive. You are safe in this moment. On your next breath, imagine drawing in warmth. And on your exhale, release anything that feels heavy or tight. Relax, melt into the chair. Continue that breathing pattern and say quietly to yourself, or simply listen to these words. Say it on your exhale. My body is mine. My body is mine. My pleasure is mine. My pleasure is mine. My healing belongs to me. My healing belongs to me. I am worthy of pleasure and intimacy. I am worthy of pleasure and intimacy. I am worthy of love and belonging. I am worthy of love and belonging. I am worthy. I am worthy. Take one last breath in and gently exhale. Whenever you're ready, bring your awareness back to the room. Thank you for joining us, and remember, you are worthy of healing, connection, and pleasure. Well, what's up next week, Vic, on Dr. Jeff Talks About Sex and Intimacy?
What does it mean to masculate in a way that is healthy, authentic, and connected? In this episode, Dr. Jeff is joined by Leroy Gordon, a coach, speaker, and thought leader on men's well-being. They explore how men can embrace strength without domination, vulnerability without shame, and intimacy without fear. This conversation offers a roadmap for men who want to thrive in their identity while fostering deeper connection and balance in their lives. Join us on December 16th at 7 p.m. Central Time to learn more.
Yes, I think as men, we all need to hear those messages and learn healthy masculating. It should be a great episode. But today, gosh, oh, Dr. Richmond, I can't thank you enough. Your work has profoundly impacted my work and my patients. And your research, all the things that you've done, they've really given people a way to navigate their way back to pleasure, away from trauma. And I just thank you. Is there anything else you'd like to share before we close out?
No, just profound gratitude for the invitation to join you and for your work, Dr. Jeff. Yeah, I love all of the synergy and the resources you offer. So thank you so much for that.
So listeners, I just want to take this moment to tell you, if you've experienced trauma, trauma does not define you. It is not who you are in any way, shape, or form. It is something that happened to you. You had no part in it. And my greatest hope and prayer for you, and I know Dr. Richmond feels the same way, is that you find your way to thriving and pleasure again, because you deserve it. And nothing that happens to you deserves that power over now, this moment, this miraculous moment. So I hope you embrace that. And I hope we've given you some tools to do that. Thank you so much for joining us.
Who's